Hello, my name is SANKALAN GOLDAR. I am a final year 8th semester MBBS student from Eye Care Institute of Medical Science and Research and Dr. B.C. Roy Hospital, Haldia. With due respect to all my teachers, I start my presentation on COVID-19. I shall be saying this presentation under these following headings, and the DOI link of the research articles used here is given here below. As an introduction, it can be said that coronavirus is a large family of viruses, among which the most recently discovered is the novel virus SARS coronavirus 2, which causes COVID-19, resulting in severe illness ranging from common cold to SARS and even Middle East respiratory syndrome with substantial morbidity and mortality. Briefly talking about the epidemiology, it can be said that the first case was found in Wuhan, China on 1st of December 2019. Then WHO declared officially coronavirus disease as global pandemic on 11th of March 2020. The incubation period of the virus is 2.2 to 11.5 days and the overall case fatality rate is 2 to 3.7%. Now, few points about the viruses. The mode of transmission can happen either through droplets, then contacts, and also fomites. The virus can enter through either respiratory or fecal-oral route. The genome is linear positive single-stranded RNA which is non-segmented, and the outer envelope, which is the capsid, is made up of glycoproteins, and the most important glycoprotein is the spike glycoprotein, which the virus uses as a docking molecule. This is the schematic representation of the virus. Then briefly talking about the pathophysiology, the virus uses its S-glycoprotein to get attached to the ACE receptor of the host cell, which is most commonly the type 2 alveolar cell. Then by the process of endocytosis, it enters into the host cell. Then the virus gets uncoated. The viral genome is then released. The viral gets attached to the host cell ribosome, either the cytoplasmic ribosome or the ribosome on the endoplasmic reticular surface. Then by the process of translation, it produces various polypeptides, and then new virus particles are formed from those, and then by the process of exocytosis, new virus particles are liberated out of the host cell. Now in this same picture, the same story is being said that the virus enters here and the proteins are being made, and then virus particles are formed inside the Golgi fascicles, and then by the process of exocytosis they are liberated out of the cell. Now as the virus is liberated out of the cell, the host cell gets ruptured, which is mainly the type 2 alveolar cells, and they release pro-inflammatory cytokines like interleukin 1, 6 and TNF alpha, which causes exudation of fluid from the blood vessels to the alveoli and alveolar spaces, which causes decrease in exchange of gases and difficulty in breathing. Hence, the patient requires ventilatory support. Other effects of cytokines on kidney will cause increase in urea and creatinine levels. On the heart will cause increase in troponin levels. On the hypothalamus, it will cause fever. And this incident is called cytokine storm, which happens in 3 phases. In phase 1, there is infection of the epithelial cell. On phase 2, there is acute inflammation. On phase 3, there can be either severe disease or resolution. And then the clinical features, the patient can have shortness of breath, pneumonia, septic shock, renal failure and diarrhea. The patient may present with fever, headache, hemoptysis, cough and myalgia. Then lab diagnosis can be done by molecular test, where RT-PCR is done on the naso and oropharyngeal samples. Then serology, we check the IgG antibodies, which indicates immunity from the future SARS coronavirus 2 infection. In early stage, there can be normal or decreased WBC count, increased values of liver enzymes, increased D-dimer, and elevated neutrophil to lymphocyte ratio. There is no specific management as of yet, no antiviral treatment and no vaccine available. The treatment is done completely based on the symptoms. Oxygen therapy represents the first step for addressing a respiratory impaired patient. Then drugs like hydroxychloroquine, remdesivir, lopinavir are showing variable results, but all drugs are under trial. Then preventive measures are the current strategy which are being followed to limit the spread of the disease. According to the WHO recommendation, we should avoid close contacts with the infected persons, we should wash our hands, we should avoid unprotected contact with wild animals and also the persons who are having respiratory infections. We should strengthen our emergency medicine departments, and immunocompromised patients should always avoid public gatherings. Finally, in conclusion, we can say that it still remains a challenge in the ongoing development for an effective vaccine and definitive treatment of COVID-19. We hope that the studies going on all over the world would be informative towards new vaccine and medication development for the prevention and cure of COVID-19. Thank you very much.